HLA system is important. HLA antigens are important in presenting foreign antigens to the immune system. And it's interesting that people with autoimmune hepatitis have certain abnormalities of their HLA genes that you can demonstrate. I think that's all I was going to say a little bit about. Right, I'm going to get on to presenting symptoms now. I'm going to have it. I hope I'm not cutting into your talk too much, am I? All right, then. Shall I move on then? Yeah, we'll move on. Some of you have probably heard of your AST and ALT. These are liver enzymes, aspartate transaminase and alanine transaminase. Essentially, when something damages the liver, these go up. If you give the liver a kick, literally, your tests go up, right? So any liver injury will put the tests up. If you take a paracetamol overdose, it'll go up massively, like about 10,000. That's severe liver injury. Typically with autoimmune hepatitis, they're in the hundreds. They're about they're about 10 times the upper limit of normal. It tends to be these two enzymes. There are other enzymes that are more related to the bile ducts, the alkaline phosphatase and the GAMT, which are usually, not always, but usually normal. The other things, I said before that the immune system is revved up, so you have a raised serum globulin and particularly a raised serum immunoglobulin G. And these are actually useful diagnostic tests. If somebody has some sort of liver inflammation and these tests, the globulin and the IgG are very high, you start wondering if it's autoimmune hepatitis. The antibodies, a lot of people, the majority of people with autoimmune hepatitis have certain antibodies in their blood, and these are useful diagnostically because they will give, if they're present in the blood, it jacks up the probability that the patient has autoimmune hepatitis, so they're useful in practice. They're not thought to be causing the disease, they're just manifestations that the immune system is a bit hyperactive and revved up. That's all they are. So the commonest one is the anti-nuclear antibody, and also the anti-smooth muscle antibody. There's some rarer ones, liver, kidney, microsome. Antimitochondrial, which is mainly associated with primary biliary cirrhosis, but a minority of people with autoimmune hepatitis have an antimitochondrial antibody. This is a new one, soluble liver antigen, which is sometimes the only one present. And about, excuse me, about 20% of people have no antibodies, but still have autoimmune hepatitis, right? This is one of the problems with autoimmune hepatitis. There is, approximately about a quarter of people with so-called cryptogenic. Cryptogenic is a fancy term for we don't know what the hell is going on. Doctors are great. Well, it's not just doctors, economists, specialists are wonderful at using these fancy terms to hide their ignorance. That's a very good example. So about cryptogenic, some of them meet the criteria for autoimmune hepatitis. I'll go on actually. Histology. I'm not really going to talk about histology. I love histology, it's fantastic. But that's your biopsies, and we can have a debate maybe about liver biopsy. The one thing I will say at this stage, it is really important to have to do a liver biopsy for a diagnosis of autoimmune hepatitis. And I'm happy to have a debate about that, but I really do believe that quite strongly. This is what you tend to see, interface hepatitis. Shall I move on? Really simple. If there was a simple test for autoimmune hepatitis, one test, but there isn't. Some have this, some have that, and this is an international group, a very eminent international group that have kind of laid down this system, and in fact it works. People have validated it, and it works. So you get positive points if your transaminases rise more than your alkaline phosphatase, if you're negative for viruses, no drugs. Other autoimmune diseases, it's so helpful. It just is helpful diagnostically. So you get a diagnostic point for autoimmune hepatitis if you have had another autoimmune disease, or even in your family. Another autoimmune disease in your family, you get a point for that. So it's raised globulins, various things on the biopsy. Relapse is often helpful diagnostically. It's not very nice for the patient, but sometimes if there was any doubt that somebody had autoimmune hepatitis, it's laid to rest by them having a relapse. Okay. These are the things for which you get negative points in the scoring system. Relevant drug history, alcohol excess, positivity for the antimitochondrial antibody, or various things on the... And of course, a non-response to prednisolone. 90% of people should have a very good response to prednisolone. 10% don't, but if we actually reconsider the diagnosis, that people don't have a good response to prednisolone. What else can it be? Well, somebody talked about fatty liver. And this is actually one good reason for doing a biopsy. If you have fatty liver, is far more common than autoimmune hepatitis. But about 20% of these people will actually meet the criteria for autoimmune hepatitis until you biopsy them, when it's clear that they haven't got autoimmune hepatitis, they've got fatty liver. Hence the importance of doing a biopsy. There's other ones, Wilson's disease, vascular injury, and drug-induced hepatitis, which I'm going to discuss later actually, because it can be quite confusing that. Oh yes, I'm going to discuss it now. It's a bit semantic. If you get hepatitis and it's due to a drug, but it looks like autoimmune hepatitis, is it drug-related hepatitis? Is it autoimmune hepatitis related by a drug? Is it coincidental autoimmune hepatitis? That has nothing to do with the drug, but it's just you just happen to take the drug. It's difficult. What I can tell you is, this is the world literature on this. There's a couple of drugs, three actually, nitrofurantoin, minocycline and interferon, and there have been more than 10 cases described. Right? There's 3 to 10 cases of autoimmune hepatitis associated with these drugs, fibrates, diclofenac, isoniazid, methyl-dopa, statins, and there's 1 to 2 cases described with these drugs. So if you happen to be taking one of these drugs and you get autoimmune hepatitis, is it due to the drug? Is it coincidence? There's no way of telling, really. All you could do is maybe try to stop the drug, take it again, and see if you get autoimmune hepatitis again. Probably not very smart. It's a nice idea. You get a viral infection, it sets off autoimmune hepatitis. And there are cases described. There's about 10 cases of bona fide autoimmune hepatitis. Baron d'Or autoimmune hepatitis on the liver biopsy described post-hepatitis A. This is, remember all infectious hepatitis that I got as a kid, and lots of people here probably did? You know, you got yellow jaundice and you got better? That's hepatitis A, okay? Very common back then, less common now actually, but there's been about 10 well-documented cases where somebody has had hepatitis A, and then it seems to have changed into autoimmune hepatitis. Likewise, a couple of cases following other viruses, Epstein-Barr virus, CMV, cytomegalovirus. Very few cases following Hep C and Hep Z. There's a big series of autoimmune hepatitis in Scandinavia, and about 8 of 473 seems to have viral precipitants. So it's rare, but it can happen. Sorry. So what causes it, I honestly don't know. But doctors actually are very good at saying why, patients say, well, why me? But, and medicine isn't very good at that. It can give you mechanisms and, talk about treatments and things. But to explain why you and not the person down the road got this is actually quite hard. I think we live in a chaotic world that we don't understand a lot, and there's no point in trying to pretend we do. Having said that, this is the kind of official explanation. There's an immune regulatory defect that I mentioned, the T-cell regulatory defect. There's an abnormality with the HLA system. There are certain abnormalities that you can demonstrate with the HLA system, which presents antigens to the immune system, resulting in this system having an affinity for certain antigens that maybe other people don't have. So certain antigens are maybe presented to the immune system that wouldn't be in normal people or people without autoimmune hepatitis. That's the antigen. Is it a virus? Is it a drug? Usually not, as far as we can tell. Maybe it's something released from cells following damage. We don't know. There's immune cell reactivity, and then there's cross-reactivity. The immune system develops a reaction against this antigen, and then maybe the antigen is quite similar to a protein on the liver surface, and the immune system then attacks the liver. But it's a pretty lame explanation. We honestly don't know.